Hello friends, hope you all are doing well. I'm Shikha Singh and I welcome you all to my channel. Friends, इस वीडियो में we are highlighting Georgia. Recently, we were privileged to welcome some of the officials of European University Georgia. उन लोगों ने हमें हर एक बात जो भी एक स्टूडेंट जानना चाहता है अबाउट द कैंपस, अबाउट यूनिवर्सिटी, फैकल्टीज एंड ऑल, वो डिटेल में बताई. तो आई थॉट आप सब भी वो बात जाने एंड आई डिसाइडेड टू मेक अ वीडियो फॉर दैट. Please watch this video till the end so that you'll not miss anything. So today we are welcoming Ms. Tama, who is Vice Rector of European University, Ms. Nino, who is the Dean of European University, and Mr. Gocha, who is the Rector of the University. Thank you so much for visiting us in our Delhi office.
For inviting us. It's our honor to be here for today. About Georgia, I would say a few words. The Georgia country is associated member of European Union. It's a very safe country, and safety and security is very important for us as a country, as a member of this union. Also, the educational system nowadays, that Georgia is the hub of education in this region. So, educational system is all these standards and all these programs and curriculums are done and followed by European guidelines and standards, because we are the part of the special organization who is guiding all these things in those countries who are part of European Union. So same is in Georgia as well. So this is why the degree which we give our students who graduate is acceptable, and also it's authorized and recognized not only the European countries but in the USA, in Canada, Australia, in UK and etc. So this is very important part for us, because just compared to other countries in this region, we can say that Georgia is number one, just because the one and the most important thing is that Georgia is the part of European Union and associated member of European Union, and educational system is also followed to European guidelines and standards.
And about European University specifically, if you can give us some knowledge about the university and specifically for medical studies. Yeah. For the students of willing for doing the MBBS.
Yes. Medical doctor program in English at our university. We have too many students from different foreign countries. Right now we have students from 68 countries. We have also Indian students, around 800 Indian students at this moment. University is like the family, and like they feel like they are at home, because it's not a big university, and this is the very big advantage for the students and for us as well, because we have everyday communication with them. We have everyday, if they need any help, any support, our doors are always open and they are always welcome. The program itself, it's for 6 years. The duration of the program is for 6 years, and also just in India it's differently. It's MBBS for 5 years and 12-month internship, right? In Georgia we did differently, and it's just followed by the European guidelines, of course, and we have duration of the program, we have 6 years, but for 3 years at the beginning the students are having some basic subjects such as anatomy, physiology, imaging, biology, biochemistry, etc., and with clinical skills as well, which they will have in our simulation center, which is very important to underline, because we are one of the first university, and at this moment only private university who has its simulation center. And after 3 years, so 4th, 5th and 6th year of their study, they are having internships in different clinics and hospitals.
After 3 years?
Yes. For 3 years they are doing that. So because of that, they do not have to do that 12 months internship when they are back to India, because we give them, of course, with diploma and diploma supplement or documentation which are needed, and one of the documents is the certificate of internship, which proves that they have done this internship in those clinics, and it should be recognized in India as well. So this is very important part. So they need to spend 6 years of their study study, and then they will get the degree. They do not have to pass any extra exam or something like that after 2 years, 3 years. No, we don't do like that. They start from the first year, and they are doing it for 6 years, and after 6 years they graduate. Yes, they get the degree. Yes.
How about campus?
We have our own campus for medical doctor students, and also I can say that we are the only private university who has its independent campus for medical doctor students, and all facilities are there. We also have our dormitory, and we also are one university at this moment in Georgia who has its own dormitory, and we give this service to our students as well. Now, normally at the dormitory we have students from different countries, but if there will be any necessity, of course we can offer some Indian food for them as well, because that's very important. Very important
for Indians.
Yeah, the situation in this case, it's very nice in Georgia, and because we have lots of Indian students at this moment in Georgia, not only at our university, but in Georgian country. Because of that, nowadays you can find too many Indian restaurants, which we are visiting as well because we love Indian food. Too many shops where they can find all things they need, and they can also prepare for themselves, and if they need any specific things from India, they can find it in that shop. But besides, we always try to listen to the feedback from the students, and there was too many the students who we are asking about the Indian food, and that wouldn't be a problem at all. We will do our best to offer this service as well to them.
Okay. And if we talk about hostels, do we have separate hostels for girls and boys? Actually, there are some parents who are
of course. Yes, this is very important for us. We are associated members of European Union, but our mentality and traditions and culture is quite close to Asian countries as well. It's quite close to India, because I'm here for 2 weeks and I see how important for you is, for example, family support. It's
parents,
like same parents, same in Georgia. Even now I'm 32 years old, and my mom is taking care of me as a child, 2 years old child. So this is very normal and very common in Georgia as well. Because of that, we have a separate floor for boys, separate floor for girls. We have 24-hour security. They are the special doors which are closed, of course, so the boys can enjoy the girls' campus, or in the opposite way, the girls to boys. Also, we have CCTV cameras all around in the building, because security is very important for us. We say that this is our family. We are family members, so we are we take care on our children, and not only our students, but they are our children as well. So because of that, the safety and security is so important for us. We have 24-hour security at the university building, at the dormitory, and as I said, country itself, it's very safe, and the parents should...
Actually, parents are sending their kids abroad. There are many parents who take this step after lots of research, and they want to know each and everything. Exactly. There are many parents who even do not have travel their own, but they want to send their child to get more knowledge, good studies and all. So that is why each and every question should be answered.
Yes.
And security, as you have already explained, security is their major concern.
Very important.
Especially here in India also, as you're saying, in Georgia and India, the conditions are the same, in terms of family and all. Here, even now, students ask this kind of questions. They want, better security for girls as compared to boys. So that's why
we just do the same, of course. For us, it's important if they have any health problems, for example, or something like that. That's why it's mandatory to have health insurance. For our safety, for parent safety, for student safety, and for the country as well. They cannot cross the border of Georgia if they do not have the health insurance, especially in this situation. As you know, the coronavirus is still around, so it hasn't gone.
How's the condition now, post-pandemic here in Georgia?
It's quite nice, because, we have, the vaccination is available, so if they are not vaccinated, they can do it in Georgia as well. And there are too many places where they can do it, and also we try our best to keep this safety and to keep this situation as safe as it is now. It has not gone, of course. nowadays we're still around coronavirus, but the situation is stable and good at this moment.
Great. Can you also please advise me about the faculties and the teaching staff, kind of so that I myself and we can impart knowledge in our students, because faculties is something in MBBS plays a very, very vital role.
Yes.
So there are a lot of parents who ask about the faculties, the kind of teaching standards.
Yes, of course, I will explain. The teaching standard is very important for us. We always say that quality is very important for us. Without quality, there are some other universities in Georgia. Of course, we are not the only one, but for this competition, the most important thing is quality. What do we do to have the best quality in this case? First of all, the lecturers, they are one of the best doctors in Georgia. They work in hospitals, of course, and another thing we are checking is their knowledge of English language. One thing is to be a great doctor, but another thing is to have English language knowledge and to have the knowledge to give this information to the students properly, right? So because of that, we decided they are making some, as an example, some lesson or lecture for us. There is commission who are checking this, their English language knowledge, their knowledge and skills of studying the students, and after that we are starting working and collaborating with them. This is very important part. Besides, at the end of every semester we have different units, we call it Quality Assurance Office, and the Quality Assurance Office is sending the survey to the students, which is anonymous. They do not have to write down their name and surname, but they are welcome to write all information very truly, honestly, because the feedback is very important for us. Why do we do that at the end of every semester? When they end the semester, we need to know how was the subject, how was the lecture, how was the facility, what is enough or not, how was the exam, how was the communication with the staff members and administration, what do they like, what are advantages and disadvantages of being here at our university. Then we do the Quality Assurance Office, they do that report, and we are discussing it with Vice Rector, with Dean, with Rector, with President, and finally we try to fix if there is any problem, to become better, right? And this feedback is very important for us. Without the feedback, we cannot go in front and yes, and that's why we do it every time, because
we listen in students, it's very important, and students can come anytime to us. Every student have manager and they can talk with managers also.
That's actually very important. If everybody remains reachable.
Yes.
Exactly.
Every room in our university is open for students. Every room, everyone, we are ready to talk with students anytime. If I'm busy, students first for me.
And that's good.
Our university focuses
good results.
Yes, we have very good feedback also. Okay. Our students already graduate from India also. They pass FMGE exam. We support them.
Actually, students want to ask about what is the ratio or the rate of passing FMGE exam. This also comes when students come and they ask about a particular university, or if we are convincing them for a particular university, the questions which we are discussing are the main focus points of students or parents. And they generally ask about hospitals also, where they're going to go for the internship and all. You can give us idea about that as well.
We have the special list of the hospitals whom we are working with. We have some learning agreement with them, and the students are always going to that hospitals. They have their doctor there, and who is the lecturer at the same time, so who is the supervisor of these students, and they are attending some surgeries as well. They have communication with the patients, and they act normally like as a junior doctors, but under supervising of a main doctor, of course. Our graduates, I always would like to underline this thing as well, because we have some graduates from India as well who passed the FMGE exam with the greatest, without any preparation, by the way. When they arrive,
there are kind of preparations, facilities or kind of coaching facility for FMGE or for any
actually, the curriculum which we have, medical doctor program itself, it covers the things, the topics which are necessary for FMGE exam. That's why they came here without any problem. They didn't prepare some special preparation they didn't make, but they passed the exam. It shows one more time that this program
We have result already.
Yes,
it's
we
very
already.
important for us.
The result is very important for us, for our reputation, for
Actually,
our
this is-
for.
Yes.
And there are many students who actually wanted to opt for USMLE and PLAB exams. So the guys,
Yes.
there are many
After-
They
students
can
who-
do that as
Yes,
well.
we have experience also for that. Our students who are now in 30 years, they apply already for USMLE and they try. They start and they try. And also in this case, we support them. We help them for apply to USMLE. Try do everything for this, and we are waiting result from step 1 now.
Okay,
Yeah.
okay,
Yes,
okay.
yes.
Thank you so very much for all the
Thank you.
details
Thank
you
you
have
very much
provided
for
us, and I'm
inviting
sure
us.
they're going
Thank
to
you.
help us in counseling students and giving them the right information.
Yes,
Yes.
So
right
that
information
yeah,
is very important.
very important.
Yes.
Giving
We are
them
with
each
you,
and
we will
everything
support you
right and
yes.
what actually is the right picture, which will help us in our
Yes.
counseling.
Yes.
Thank you so very
Thank
much.
you very much.
Thank
Thank
you
you so
very
much.
much.
Thank you.